Thank you to SAGES and to the organizing committee for the opportunity to present our work. I have nothing to disclose. The focus of our work is this question. When we want to describe how a surgeon gains experience and progresses, we can imagine the learning curve here, where X is the time or number of cases, but what is the Y-axis? How do we define and measure surgical skill? Previous studies mostly use operative time to describe the learning curve, but other variables have been described: blood loss, oncologic outcome, length of stay, and many others. The most common descriptor of skill has historically been operative time. Our study looked at a relatively standard procedure: robotic sleeve gastrectomy, a case that can be broken down into 3 steps: ligation of the short gastrics, gastric transection, and oversewing the staple line. How much of this operative time is skill-based and relies solely on the surgeon? Even in a robotic case, there are portions of the case that may not be the most relevant: port placement or camera cleaning, or portions that rely mostly on the assistant, instrument swapping, or waiting for stapler reloads, resulting in only a portion of the time that is truly active operative time and relevant to the surgeon experience. Operative time may not be the best descriptor of skill. For a more objective measure, Alvin Go and others created the GEARS score to break down robotic skill into 5 domains that can be measured on a Likert scale from 1 to 5. For example, a 1 in force sensitivity would describe rough movements, tearing tissue and breaking suture, versus a 5 that would demonstrate more appropriate tension with negligible injury to adjacent structures and no suture breakage. Neither operative time nor GEARS score has been truly validated as an objective measure of skill. We hypothesized that these 2 variables measure different parameters of skill and will not correlate. If this is true, neither should be used independently to measure or describe skill. To address this, we performed a retrospective review of prospectively gathered data from January 2019 until March 2020 and captured 68 patients undergoing robotic sleeve gastrectomy. We established a partnership with CSATS Inc. for crowdsourced grading of robotic videos. To do this, we created a HIPAA-compliant encryption methodology wherein videos could be sent to CSATS from the robotic tower in the operating room for crowdsourced grading, and then those scores were sent back and the MRNs de-encrypted to allow the research team to link the operative video and scoring to patient information. We found a mean operative time of 112 plus or minus 27 minutes, and our GEARS scores followed a normal distribution with a mean of 20.1 plus or minus 0.8. We analyzed the overall operative time and GEARS score and found no correlation with an R-squared of 0.0146. Given our thoughts that overall operative time incorporates steps of the procedure that may not rely on the surgeon, we analyzed 3 steps of a sleeve: ligation of short gastrics, gastric transection, and oversewing the staple line. There was no correlation between step-specific GEARS score and time for the ligation of the short gastric step with an R-squared of 0.054. We found a weak correlation between step-specific GEARS score and time only for the gastric transection step with an R-squared of 0.07 and a p-value of 0.028. There was no correlation for the oversewing the staple line step with an R-squared of 0.014. While our study should be repeated with a larger sample size to minimize the chances of a type 2 error, we did not find a correlation between operative time and GEARS score. We suggest that when attempting to define surgical skill, either for surgical education, for credentialing, or to describe a learning curve, consider using multiple variables across domains rather than one alone. Incorporate subjective variables like expert review, objective variables like skill assessment tools, those that describe patient outcomes, either their oncologic or their length of stay, and technical scoring like operative time and blood loss. Incorporating all of these measures will allow you to more fully describe surgical skill. In summary, operative time and crowdsourced gears score were not correlated for robotic sleeve gastrectomy. Operative time and gears score measure different performance characteristics, and future studies should consider using both a validated skill assessment tool and operative time for a more complete evaluation of skill. Future studies from this group will evaluate the relationship between gears score and clinical outcomes. Thank you for your time, and if you have any questions, I'm happy to continue the conversation at paddison@northwell.edu. Thank you again.